welcome everyone. I have that it's noon here in Central Illinois. So hello, my name is Chelsea Byers and I'm a family life educator with University of Illinois Extension, and I'd like to welcome you all to the Autumn Health Picks series. This series is a collaboration between Illinois Extension and the Interdisciplinary Health Sciences Institute at University of Illinois, and it's designed to connect those across the state with researchers at the university and provide evidence-based educational programming. Just a couple housekeeping items before we turn it over. I'd like to launch a poll. This poll is to collect some basic information from our participants. Molly, if you could launch that poll for me, that'd be great. Just a reminder, we will be recording this program, so please keep your videos off. And also the chat box is there if you have any questions during our session. We will keep the poll up during the session for people when they join. So once you fill out the poll, just feel free to minimize it off your screens. If you're seeking CEUs or CPDUs, I'm going to put a link in your chat box. Please go and sign in to let us know that you are here, so we know that you are here for your CEUs. If you're calling in today, the link that you can go to is go.illinois.edu/credits. Again, for those of you who are not on a computer and are calling in but need to register that you are here for your CEUs, you can type in on a web browser, go.illinois.edu/credits. If you have any questions, again, just put those in the chat box, and we will probably hold those questions to the end unless it's a clarification question. So now, without further ado, I would like to introduce our speaker for this series. It's Noah Hutchinson. He was one of our summer series speakers as well. Noah received his Bachelor of Science degree in Exercise Science and a minor in Biology in 2019 from Truman State University. Noah's undergraduate research focused on the performance-enhancing effects of carbohydrate mouth rinsing in athletes. Noah is an American College of Sports Medicine certified exercise physiologist and is currently a PhD student in the Division of Nutritional Sciences at University of Illinois. His PhD research focuses on how certain dietary and exercise interventions interact with the two-way relationship between the gut microbiota and the immune system. So today he's going to talk to us about dietary defense and how nutrition can impact immunity. All right, take it away, Noah.
Awesome, thank you for that introduction. So let's get started. So a lot of this was already said, but I have my bachelor's in exercise science. I grew up in Mount Pleasant, Michigan. I'm a second-year PhD student, and my research primarily focuses on the immune system and how it interacts with the gut microbiome and certain behavioral and dietary interventions. So what I'm hoping that you will get from this talk today is a brief overview of how your immune system responds to pathogens. And then we're going to get into how is this influenced by nutrition and some other important lifestyle factors that you should be taking into account. And then lastly, we're going to make sure that we talk about what we can do on an individual level to keep ourselves as safe and healthy as we can. So a quick disclaimer before I get too deep into any of this. I am not a doctor, nor am I your primary care physician. This is not medical advice and should not be taken as direct medical advice. Everybody is different. Generally, diet and exercise recommendations are individualized for each person. There are a lot of factors to take into account, and that's why people hire personal trainers and dietitians and doctors, etc. So definitely consult a physician regarding any uncertainties or any unusual things you may start doing, especially with supplements. Those should be done with caution, and I will talk a little bit about this later. And always exercise caution when you're talking about your own health. Obviously, this is quite important. And none of these guidelines I'm giving you today are going to make you immune completely to infection or remove all risk. And just remember that the most effective approach is generally a combination. And regard these things as additions to your approaches and not necessarily replacements. So real quick, I'll just talk about what a virus does when it enters your body. So a virus is going to incorporate its own genetic material. This could be DNA or RNA or both into your cells. What it's then going to do is then use your cell's replication mechanisms to then replicate itself. The ribosome is very frequent here. And then this will cause the virus to release more of itself and then kill the cell in the process and spread through the rest of the body. And a dysregulated immune response to these viruses can also contribute to secondary damage within the body, and I'll get into this more in just a second. So this is a figure from the July version of my talk. Just a quick scan to see what people thought about when I asked about immunity. Notice how there are a lot of different factors here. There are a lot of different words, and that's appropriate because it's a very multifaceted issue, and hopefully we'll cover a decent amount of these today. So the immune system is classified into two major arms. You have the innate and the adaptive immunity responses. So in the innate immune system, it breaks down to even behavioral stuff. So the best example is there are certain smells that nobody likes. Generally, that is because these smells are associated with substances where overgrowth of certain pathogens is very common, like fecal matter. Next, you have your physical barriers. Obviously, the skin being the most apparent example of that. You have your mucus layers in your lungs and in your nose, in your nasal cavity and everything like that. Next, it gets to an inflammatory response. So if you've ever sprained your ankle or hurt yourself in any way and it swells up, this is your immune system activating an inflammatory response to initiate healing and defense mechanisms. And this arm of the immune system is what's going to be faster acting, and it's generally non-specific. It can be somewhat specific, but it's nowhere near as specific as the adaptive immune response. So the adaptive immune response is much more delayed. Some parts of it happen within hours, but some parts take up to weeks or days. It's very long lasting. There's a term called immunologic memory where, you know, most of these things that are committed to memory last pretty much your entire lifespan. And this is responsible, the adaptive immune response is responsible for that. It mounts a specific response to every pathogen. And so this is what's manipulated when you're given a vaccine. They give you an attenuated or weakened, I guess, form of the pathogen, and your body is able to form an adaptive immune response and remember it. And it's important to remember that these are classified separately, but they do work together and help orchestrate each other. So this is kind of what the cascade of events happens during an innate immune response. So when exposed to a pathogen, any sort here, you have the flu, maybe the common cold, the blood cells and body cells will kind of act as sensors and pick up on the infection. They will then, once they have detected the infection, initiate pathogen clearance mechanisms and release mediators. These cytokines and chemokines will signal to the rest of the body, the rest of the immune cells, that help is needed and that something is wrong. And then you have your inflammatory response, which involves vasodilation and recruitment of more immune cells and activation of other specific mechanisms. So this is just a good example, a good figure here that shows you kind of what's happening with the swelling that you see. So you have an immune cell here. This is a macrophage, but there are many different types of cells that do this. It's releasing these cytokines and chemokines, which is then causing this blood vessel to dilate and then release other immune cells and proteins and fluids into the tissue over here. And then these immune cells and fluids and proteins are going to start helping clear the pathogen. And that's generally where the pain comes in. That's where the inflammation comes in, the swelling, whatnot. And cell death can be both a consequence and a cause of this whole process happening. I know this figure is pretty blurry, but I'm going to talk through it so the blurriness won't affect us too much. So this is what generally happens. This is the primary mechanism of an adaptive immune response. So you have an immune cell right here. This one is a dendritic cell. And what they do is they kind of engulf the pathogen, or, in this case, it's bacteria, but it can be other things like waste matter or a virus. And it's called phagocytosis. It kind of just swallows it whole, essentially. And then it takes part of that pathogen called the antigen and presents it on the surface of the cell. And it will then take that antigen and then show it to, in this case, it's a helper T cell. And then this helper T cell will activate, and then we'll be able to do other specific immune activations. Some of these helper T cells will then help B cells mature. B cells are other adaptive immune cells, and this will initiate a process called clonal expansion that will cause the B cells to mature into plasma cells, which can then secrete antibodies, which are pathogen specific and very effective. And this takes a matter of days. So this is a quick summary slide of everything I just went over. So once past the anatomical barriers and inside the host tissues, they will initiate these preformed defense mechanisms. The immune cells will then also recognize the pathogen. They'll attempt to clear it, and also the infected cells that are being pulled down by it, and then also send signals to other immune cells that there is a problem and that help is needed. So while the other immune cells come over in an inflammatory response, some cells are going to bring the antigen to the lymph tissue for the maturation of pathogen-specific lymphocytes like T cells and plasma cells, which will secrete our antibodies, and then they will help clear the infection. I got into a little bit more detail on a lot of this in the talk I gave in July 7th. And I also talked a little bit more specifically about why COVID-19 is more concerning or is more of an issue. So if you would like any more specifics on those things, I recommend you go check that out. It could be quite informative. Additionally, there's a lot more information on exercise and how to use exercise strategically. And we'll talk about that a little bit today, but not as much. So next, how about we get into some stuff that we can do about it? So here I have some important nutritional factors to take into account for, we have cold flu season coming up, and of course, COVID-19 is still around. So one thing to really take into account that has shown a pretty strong effect on immune responses is excess fat mass. There's a pretty strong association between excess fat mass content and the severity of certain viral respiratory infections. It's also, excess fat mass is frequently associated with chronic inflammation, which can cause a disruption to the balance in your immune system and can cause immune responses that may not be very appropriate towards certain pathogens and can actually cause some secondary damage to you. And frequently associated with excess fat mass is cardiovascular disease, which is obviously arterial dysfunction is a pretty big part of that. So this obviously will interfere with the respiratory immune response as well and give you a harder time with that. And I think a lot of us are aware of this already, but excess fat mass is generally remedied by a combination of diet and exercise and other lifestyle factors. However, there are some extenuating circumstances that may cause other interventions to be necessary. Back in September, one of my colleagues, Ru Liu, gave a very good talk breaking down a lot of diets that can be used for certain weight loss goals or even health goals. So I recommend you check that out if you want more information specifically on vegetarian, vegan, and paleo diets, and talk about some of the pros and cons of those dietary patterns. So the Western diet is a term that's often used for the dietary patterns that we see in American society. Generally, it hasn't always been ideal for health. You can think about the documentary Super Size Me and other things where, we as a country, our dietary patterns have become relatively high in saturated fat, lots of sugar, refined grains, and a lot of foods that have a lot of calories in them. And a lot of them are pretty low in fiber. And obviously, these dietary patterns tend to promote weight gain, This has actually reached epidemic status in the US, and it tends to be low in other key micronutrients as well. So as you can see, this paper here I have a screenshot of talks a lot about the relationship between this Western diet and how its suboptimal nutrient content generally leads to chronic inflammation. And this chronic inflammation is generally going to disrupt the balance of your immune system. And in this case, it's maybe not going to give you the optimal response to a viral infection. This obviously also, these dietary patterns contribute a lot to cardiovascular disease. And we can also see some, like I said, chronic inflammation and some cellular stress. None of these are things that we want when attempting to deal with a viral infection. So some quick suggestions that I have, and there are plenty more than this, but these are some commonly given suggestions, is to watch your caloric intake. Caloric intake is going to be the #1 contributor to the gain of excess fat mass. So if you have trouble with this, writing down what you eat when you eat it may help with this. This often helps a lot of people and will also help a professional analyze what you eat. Even if you can get details like when you eat it, how you prepared it, portion sizes, all these things will be quite helpful in any goals you may have dietarily. One thing that is often recommended is cook with olive oil instead of butter. Olive oil is going to provide you with those unsaturated fats that are given, that will replace the saturated fats in butter. Limiting fried foods is always a good idea. Pretty high source of saturated trans fats. So try grilling instead. Try other cooking preparation techniques. It's obviously a good idea to limit sugar. If you can, swap it out with fruit or something else. Sugar-sweetened beverages are generally something good to take out of the diet. And consuming whole grains rather than refined grains will be better too. Higher fiber content and generally reduced in the caloric density. And like I said, there are many other options, and it's not limited to just these. So next, I'm going to get into some key micronutrients that we have associated with antiviral immunity. There's quite a few studies that have been looking at this, especially with the rise of the COVID-19 pandemic. So when I say micronutrients, think about vitamins and minerals and these little things that we talk about in our diets that aren't, carbs, fats, or protein. Those are macronutrients. So an important note before I get too much into any of this is that micronutrients do have an upper limit. What I mean by this is that consuming too much of it can be harmful and in some cases even lethal if you're not careful. So it's very pertinent to make sure that you are aware of the requirements specific to you. This relates to your size. It can relate to your sex. It can relate to a lot of things. So before supplementing or eating too much of these, very important to make sure that you have determined the proper dosage, or even better, to consult somebody who has the expertise to guide you on that. So the biggest one that's been talked about recently has been vitamin D. And vitamin D has shown some pretty vast roles in the immune system, specifically viral infections as well, and especially with the respiratory tract. So pretty much all immune cells should respond to vitamin D. It's actually classified as a hormone, and it has a sort of signaling system that it works on. It plays a really big role in the prevention of autoimmune conditions, and autoimmune conditions are not going to help your immune response. They're actually going to hurt it quite a bit. Vitamin D is pivotal in the proper function of many subsets of immune cells. So what it's been shown to do is to reduce the severity of inflammatory responses by improving other pathogen clearance mechanisms. So it's kind of specifying your immune response into a more appropriate response. This is frequently done in many lung conditions. I know cystic fibrosis patients are often treated with vitamin D during pulmonary episodes. And it also enhances the development of immune cells, making them more effective. And there is reason to believe that it may influence antibody production. So vitamin D, obviously the biggest source of vitamin D in our life is the sun. 10 to 30 minutes of sunlight exposure can provide a pretty good amount. There are also dietary sources. So you've got your salmon, that's a pretty good source. Eggs also provide a pretty good amount, and mushrooms. Mushrooms can help quite a bit with that. So I bring this up and I talk about this a lot because insufficiency of vitamin D is actually very common. It was recently estimated that about 1 billion people worldwide are insufficient in vitamin D. So with specific attention to viral infections, there have been some very large sample size studies that have looked at vitamin D status and certain outcomes. So these large sample sizes have shown us that vitamin D status has been linked to COVID-19 mortality rates pretty significantly, actually. And we'll get into this a little bit more later. And infection rates of multiple respiratory tract infections, it's at least 4 or 5 of them, if not more, have all been linked to nationwide vitamin D status within the population. And additionally, illness severity of the common cold, the flu, and COVID-19 have all shown pretty strong relationships to the patient's vitamin D status. So you can see that low vitamin D status is pretty important on a population level. But more specifically, we do have a randomized controlled trial that actually did look at patients with COVID-19 and treating them with vitamin D. So in a Spanish hospital, there were 76 patients that were in the hospital with COVID-19 pneumonia. And these patients were randomly allocated to either vitamin D or no treatment. Now, obviously, the study design is not perfect. As you can see, in the treatment group, you've got a much higher sample size than you do here in the control group. However, this 3 high dose treatments of vitamin D that they gave them actually reduced the risk of ICU admission 25-fold. So 50% of the patients that did not receive the vitamin D treatment required treatment in the intensive care unit. However, only 1 individual on the vitamin D treatment required intensive care submission. With deaths, we don't have enough data here to really run off of because only 2 patients died. However, it is noteworthy that both of those patients were in the control group. So current evidence suggests that maintaining adequate vitamin D status is critical in immune resilience and minimizing the risk of contraction of a viral respiratory infection, especially COVID-19. So up next, we have selenium. Selenium can be found, selenium is a mineral, it can be found in, here I have Brazil nuts are a very good source. Pork is also a good source. We've got our red meat here, and shrimp. Shrimp are also a pretty good source of selenium. So selenium is very important for the production of what are called selenoproteins, which play a pretty big role in cellular viral defense. Additionally, high selenium status and supplementation of selenium has been shown to increase production of key immune cells in viral responses. Selenium has been shown to increase the antioxidant activity in the lymphocytes, which are adaptive immune cells. And you can think of antioxidant activity as kind of rust protection or, an extra damage protection. So deficiency of selenium is also associated with much higher viral infection mortality risk. And this has obviously been looked at a lot in COVID most recently, just because of the recency of it, but it has been shown in other viral infections as well.
Noah, before you go on,
yes.
We did have a question for clarification
Sure.
on the vitamin D with the research. D2 or D3 was the question. Did it say in the study?
So there, it was not either. So what they actually gave them was it's the bioactive form. It's called calcidiol. And that is the form of vitamin D after it is metabolized by your liver. So if you're looking for supplementation, it would be more closely related to vitamin D. However, it's not really either of them.
Thank you.
Yep. So up next, we have zinc. So zinc is a precursor for many antiviral associated proteins. Zinc is very important for signaling in the immune system, and the communication is obviously very important in making sure that the responses are appropriate so that each cell knows what it needs to do and has its commands in order before it does anything dangerous. So deficiency in zinc has been associated with an increased risk of viral infection, and it's also been associated with something called thymic atrophy. So thymic atrophy, atrophy refers to kind of the degeneration of a tissue, and the thymus is important tissue for development of adaptive immune responses. So thymic atrophy, this kind of wasting away of this thymus tissue, will lead to defective adaptive immune responses to pathogens. So in some studies, they've shown that supplementation has displayed clinical improvements in symptoms in children with pneumonia, but it does not stop there. There have actually been a couple clinical case reports in hospitals where they have given COVID-19 patients oral zinc salts. And so in the first one, what they saw was in these 4 patients that were given high dose oral zinc salts, they saw a pretty marked improvement in symptoms. It's important to note here that the study design is not perfect, right? It's really just observations is what a clinical case report is. It's not a randomized controlled trial. It's not giving us, excellent conclusions here, but it is somewhat interesting to maybe follow up on with other research. And in the second one, in the second clinical case report, they saw that 3 patients with gastrointestinal symptoms were all discharged within 5 days after they were treated with zinc. So what we can conclude from this is that zinc supplementation may be helping these patients, but we're going to need some more controlled studies with more refined study designs to let us know if this is actually, causation and not just kind of an association. So up next is vitamin A. Vitamin A can be found in carrots, sweet potatoes are a good one, spinach, and your squashes and associated vegetables. So vitamin A is very important for proper barrier function, which the cell barriers are used in a lot of communication pathways between cells and immune cells with each other. Vitamin A plays a really big role in the maturation of immune cells. The deficiency of vitamin A has been shown to diminish the functions of antibodies and the responses that happen as a result of the antibodies. And supplementation has been shown to increase antibody production in some vaccination situations, but also in response to a viral infection. And up next, we have vitamin E. Vitamin E can be found in spinach. It can also be found in squash. Most nuts are very good sources of vitamin E. Avocado is also a really good source of vitamin E. So vitamin E will also help protect from oxidative stress damage. It's also very important for T and B cell mediated functions. So think your adaptive immune response. So this is important, especially for a virus. And they've noticed a lot of important relationships with vitamin E and the elderly population. So this term immunosenescence kind of refers to how your immune system kind of declines in its ability to fight off infections as you age. They've noticed that vitamin E is particularly critical in delaying this process. So some of the reasons that they believe this is that nursing home residents that were supplementing with vitamin E displayed fewer sick days when exposed to the common cold. There's also been studies that have shown that biomarkers of illness during the hepatitis B virus have been improved quite a bit by increasing vitamin E. And so from this, we can kind of conclude that higher intakes may be needed in the elderly. Now, it's very pertinent to take into account that over supplementation, there have been some documentations of vitamin E exerting negative side effects. Now, my recommendation for this is it's always better to get your vitamins from a food source, almost always better to get your vitamins from a food source. So vitamin E supplementation appears to be one of the higher risk ones. Now, obviously, that's not true of everybody. It may not affect many people. However, this is one I would be careful of and would definitely try to get it through food sources, especially when you have, obviously, there are a lot of good foods that are very high in vitamin E. So I would recommend dietary sources and watching the levels of this within your diet. And up next is vitamin C. I think vitamin C is one of the most commonly talked about vitamins and micronutrients with the immune system. And it's somewhat warranted, as it is a potent antioxidant. So it is going to protect from that extra oxidative stress damage that may happen as a result of an inflammatory response. So this is going to be protective in some aspects and definitely will help. However, there's no conclusive evidence to its relation in improving antiviral immune responses or protecting us from becoming infected. So while vitamin C is definitely good and it's definitely recommended, it is not going to specifically upregulate antiviral immune responses. So kind of wrapping up everything I just talked about with the micronutrients, adequate consumption and status of vitamins D, A, E, zinc, and selenium have all been shown to be really important for maintaining immune resilience to viral infection. Supplementation of vitamin D, zinc, and selenium have enthusiasm in the scientific community in relation to their efficacy in prevention and treatment of COVID-19, influenza, and the common cold. And vitamin A supplementation may help with the prevention and treatment of viral infections, while vitamin C may help with treatment alone. And obviously, adequate dietary vitamin E is very important, especially in the elderly. Now, I did mention this earlier, but I will reinforce this because I think it's an important point, is that generally it's going to be most important to try to get these through dietary sources. Supplementation is used, when a deficiency is identified. If you're already sufficient in these vitamins, supplementation is probably not a good idea. So it's important to go back and analyze what your current status is, what your dietary status is, what your regular intake is before just adding these supplements. And like I said previously, always consult a specialist or an expert or a physician or whoever before you go forward and add anything new that could be dangerous. So going back to some of the earlier parts of what I talked about, avoiding excess fat mass is very helpful for healthy immune function, as it is with other aspects of health. The standard American diet that I talked about earlier that has maybe not optimal nutrient content may promote chronic inflammation and harmful shifts in your immune homeostasis, or the balance of it, due to the extra caloric intake, high levels of saturated fat, and just not really good levels of a lot of key nutrients. So some general rules of thumb that most of us in the nutrition community can give is that it's important to monitor your calories, obviously, and I said this already, I'm kind of recapitulating here. Limiting those dietary and saturated trans fats are going to be good, and try to replace them with unsaturated fats. It's also good to consume, just a well-balanced and nutrient-dense diet as a whole, and trying to swap out those refined grains and sugar with whole grains. USDA has a MyPlate website you can visit that has a lot of really helpful information. It has a lot of really good guidelines on it and a lot more specifics than I'm giving you today. So if you have more specific questions, I encourage you to check that out. And I think some of these things were touched on during Rue's talk back in September. Just to kind of reiterate, there is no best diet pattern for every individual. Everybody has their own needs. Everybody has their own habits. Everybody has things that they like, things that they don't like, things that they're able to stick to, things that they are not able to stick to. So to each, there's going to be their own. So just because your friend has gone keto doesn't necessarily mean that keto is the best option for you. Even if they love it, you know, it's working really well for them. It's definitely not the case for everybody. So it's more important what works for you. As I mentioned USDA earlier and their MyPlate, in their dietary recommendations, they have 3 patterns that they recommend. They have what's called the healthy US style eating pattern, which is kind of a modified, kind of what I talked about earlier, but with a little bit more details about the replacements of beneficial alternatives to some of the things that we don't want in that standard American diet. There's a healthy Mediterranean style eating pattern they have on there that's going to be high in a lot of those unsaturated fats. And there's a healthy vegetarian eating pattern. This works well for some people, and for some people, it really doesn't work. You know, vegetarian is somewhat controversial, but it's important to note that it really depends on the individual. So, like I said already, you don't need to strictly follow one of these patterns to be healthy. Be consistent, be mindful of what the content of your diet is, and be intentional in your approach. It's important to pursue what you want. So, kind of an example meal I put together here just to kind of give you an idea and a suggestion that, that hits all the micronutrients that I referenced earlier. So I have for you a spinach salad. I didn't add a dressing here just because I don't know. There's a lot of different dressings out there that people like. So your mushrooms are going to be good for your vitamin D. You've got the almonds here, which are going to be good for your vitamin E and your selenium. Your zinc, sorry. And then you got the avocado here and the red meat and a side of strawberries. So this is just one suggestion. Obviously, you're going to cook the red meat. You're not going to eat it raw. But these hit all the micronutrients I spoke on earlier. And there are so many more ways to put this together. I guess the point I'm trying to make here is this was pretty easy to put together. So you can get creative with it. You can have fun with it. And find something that you like. So other important factors.
Noah, we do have a question real quick.
Sure.
A question was, are any of the micronutrients lost in cooking, for example, of the spinach or the mushrooms?
Ooh, that's a very good question. I'm not completely sure about that. I think there are some differences. I would definitely consult the USDA guidelines. I know if you're, burning the crap out of them or soaking them in butter, I think that's definitely not going to help. Although the specifics on that, I don't know. Unfortunately, I can't answer that right now. So other important factors are going to be adequate sleep. That's obviously very important in maintaining health and immune health. Stress management is going to be a big one. Obviously, chronic stress is associated with dysregulated immune responses. We don't want that. Smoking is a pretty big risk factor when it comes to especially respiratory infections, which are very common in cold flu season as that's coming up. And there's reason to believe that moderate intensity exercise will help. And I'm going to touch on that in a second. But obviously, do not forget about your hygiene. I know this has been probably drilled into you a million times in the last couple months, but it stands worth reminding you that that's going to be important as part of your approach as well. So some key points on exercise and what we can do to use exercise to our advantage. Regular moderate intensity has been shown to increase certain parts of the immune response, including surveillance, kind of your body's ability to detect the virus ahead of time, and resilience, meaning kind of your body's ability to fight it off. So kind of looking at this graph here, this J-curve shape here. So on the y-axis, we have risk of infection. And on the x-axis, we have the workload. So as you can see here, as a sedentary individual, your risk is normal. With moderate exercise, the risk tends to go down. But what can sometimes happen is if you're exerting yourself too heavily, especially if it's a very unfamiliar type of exercise for you, if you're not much of a runner, but then you decide to run a full marathon one day, that may have a serious negative side effect on your risk of infection and also probably your body's ability to fight off infection for a little while. So it stands reasoning to exercise caution when doing these types of things, especially when we're at a time right now where a lot of these viruses are floating around and are relatively easy to catch. So it's definitely important to monitor that and be wary of that, especially if you believe that you are at risk in general. And so once you kind of know that it's safe to exercise, it's important to make sure that it's safe to exercise in the first place. The general recommendation based on the scientific literature has been that about 3 to 5 bouts of moderate intensity exercise that last about 30 to 60 minutes per week seems to be the most beneficial, specifically with regards to your immune system. And this recommendation does fall within the physical activity guidelines as well. So if you have more specific questions about the physical activity portion of the immune system, I encourage you to check out my July 7th webinar, where I get a lot more in depth about it and kind of some of the scientific evidence that leads me to those conclusions I give you. And if you want more information on just the general physical activity guidelines, Shelby Key gave a really good webinar back in October about just the physical activity guidelines throughout the lifespan and how you can use these as an advantage in your healthy life. So, in quick summary here, to support an optimal viral immune response, we want to consume a consistent diet that is balanced in caloric intake, macronutrients, and micronutrients. And it stands reasoning right now to kind of pay particular attention to some of these key players I mentioned earlier. So with vitamin D, it's 10 to 30 minutes of sunlight exposure 5 or more times a week has shown to be pretty beneficial in maintaining adequate levels. Obviously, you want to avoid sunburn there. So take proper care of your skin and use sunblock when necessary. And supplementing key micronutrients where there is a deficit may be beneficial, but it's important to identify that it is necessary and that you can't get it through your diet. So additionally, like I just finished talking about, 30 to 60 minutes of moderate intensity exercise 3 to 5 times a week is going to be really beneficial. And good sleep, good stress management, hygiene, and lifestyle habits are all going to lead you to the best possible immune response and defenses towards infections. So that's all I have. I'll leave time for questions, but this is next week's presentation from Mikhail Key. She will be talking about staying sharp, maintaining your brain health as you age.
Wonderful information, Noah. We do have a couple of questions that I didn't ask during the session, so I'm gonna toss those to you now. One of them was a question about only having egg whites from eggs without the yolk. Would that not be effective for vitamin D?
It definitely would not be as effective. I don't quite know how much is in the white, but it has been shown that the consumption of the whole egg is definitely going to be more effective. So if you're interested in vitamin D, I would recommend the whole egg consumption. I mean, depending on your other nutrient needs, like if the cholesterol within the yolk or any of the other things are going to be harmful, obviously don't do that, but the whole egg is going to be a lot better.
Okay. And then concerning weight, do they have a certain BMI information that indicates, in quotes, how much is too much weight impacting the immune system?
So with regards to the immune system, there has not been any guidelines set. It's kind of just association. It's been not associations, but it's been a lot of observations of, when someone falls into this category. So generally, what they use as an indicator of, excess fat mass is if your BMI is above 25 or 30. If it's higher than that, that's generally going to be probably a risk factor. That's usually the rule of thumb. That's when they generally try to help you lower that, is 25 to 30 or higher than 30 is going to be when the risk starts to increase.
I think I asked everybody else's questions. If I did not ask your question, please throw it back into the chat box. Please, if I missed it. So Also, if you could just kind of go over some of the pictures or talk about the different foods that you get some of those various micronutrients from. That was one question in the chat box, just highlighting some of the pictures that were in each of those slides. They asked about zinc in particular, but I think just maybe highlighting each of those real quick might be a nice addition real quick.
Sure. Yeah, so with this one, I have a picture of the sun because, you know, that's a pretty big one. I just finished talking about vitamin D and the sun. You've got salmon here as well, quite a good source. Here I have the eggs. Eggs are an excellent source, easy to eat, you know, affordable, whatnot. And then the mushrooms that are a pretty good source of vitamin D. So with the selenium, we have Brazil nuts. These are a good source. I know chicken is also a good source of selenium. That's something I didn't have on here. Pork. This thing up here is pork. That's going to be a really good source. You've got your red meat. That's going to be a very good source of selenium. And shrimp. Shrimp are pretty high in it as well. So with zinc, you've got this. This picture right here kind of represents red meat. I should have just used the same picture. I guess that was a little bit confusing. But yeah, you've got zinc here in this red meat. Shrimp are also pretty high in red meat. So yeah, here, these are lentils is what I had. Like, well, these are legumes, right? Lentils are a good example of legumes. But yeah, so these are, I don't think I did say this out loud, but yeah, these are legumes is what's in this picture. So these are a very good source of zinc. And then you've got nuts. Various nuts are all pretty high in zinc and are going to be pretty good for that. Do you want me to go over the rest of them?
Yeah, go ahead. And then I have two other questions that popped in. So after you're done with that.
Yeah, you're good. So yeah, vitamin A, carrots and sweet potatoes are very good sources of vitamin A. So what I have, this kind of like this pumpkin, squash, they're both relatively good sources. Squash, I think, is a little bit better than pumpkin, but either way, they're both a pretty good source. You've got spinach. Spinach is quite a potent source of vitamin A as well. And then we've got vitamin E. So the squash is also a very good source of vitamin E. Obviously the spinach is too. And the nuts, the mixed nuts are very, very good sources of vitamin E. And avocado, which is a great food, good, high in fiber and omega-3s. So, but you'll notice there's quite a bit of overlap between a lot of these foods too. That's partially why I included them, because they were kind of, you know, two birds of one stone type of deal. And then your vitamin C. So vitamin C is, you know, people talk about citrus fruits, but there's more than just citrus fruits that are associated with vitamin C. Strawberries are a very good source. You got your bell pepper. You know, think about like yellow. The orange color is, a lot of times foods are good in vitamin C if they're orange. And kiwi. I think kiwi is actually the highest source of vitamin C. And then of course your orange. I think that's all of them.
Okay, awesome, thank you. Just a couple other questions. One statement was, any research on farm families for those being outside daily, raising their own beef and pork and garden with, you know, never having the flu or never having flu shots? And then just a statement was a fun fact that they are a farm family for 33 years. So my guess is probably also no flu shot there, as maybe what Carol's trying to say. So is there any research out there on any of this with farm families, that getting the vitamin D, being outside daily, raising, you know, the health and wellness of that you know of?
Yeah, so the vitamin D aspect of it, I mean, that definitely makes sense. I haven't seen it with specific attention to farmers, but they do notice with farmers that there definitely are some beneficial side effects. I know with gardening, they notice that it can actually alter the composition of your gut microbiota in a positive way. And there have been some studies where what they kind of do is you pre-expose I think they do these in mice, but you pre-expose it to an allergen, and then, or to like an irritant of some sort that, you know, elicits like a minor immune response. And then when you expose it to something that it's allergic to, generally the mouse that is pre-exposed to the minor irritant beforehand has a less severe response. So I think there is some science behind that. It's what's called there's a hygiene hypothesis of immunology that kind of relates to that. I don't know if it's the exact same thing, but you know, specifically no, but you might be on the right track. I can't really say for sure.
Okay. Another question is are organic and or free range eggs better or higher in nutrients?
I would say for the most part, yes.
Right.
Which ones exactly, I'm not sure. I know they're very expensive, but if they're easy to get, I would say, yeah, that's probably a better option.
And then should we be using coconut oil in cooking? Question mark.
Coconut oil is not a bad one. It's a good source of MCTs, mid-chain triglycerides, which can be a little bit easier on digestion. However, it is still a saturated fat. So I don't know if I would say it's like the best option. It's not a terrible option though.
All right, and I was told that my link was bringing people to the wrong session. So let me grab copy link. All right, try this link and see if that gets you to the right one. I might have grabbed the wrong one. Oh, I think we just didn't change the first line. I think the rest of it's okay. We're asking about the immune system. So yeah. I think we're good.
Sorry,
yeah,
you're right.
That's okay. No worries. I think we're good. So Noah, thank you so much. Thank you everybody for your good questions. Everybody, your feedback is incredibly valuable to us. So we'd love to hear about you from you, sorry, what you learned about. Also, in the survey, we do have a question in there about what you would like to know more about for the next topic. For next week, so if you have any certain questions, we can give that to our speakers ahead of time. Also, your input for future series. We only have one more session in this series, but we are starting to talk about the development of a series for the spring. So if you are seeking a certain knowledge in a certain area, just throw some things in that box, because this is how we kind of shape our series programs, is by what people are wanting to learn more about. So we do appreciate your feedback in those evaluations. It is important that we receive your feedback, because that does, again, shape our programs. We want you guys to learn what you want to hear about. So again, Noah, great job. Thank you again for being a speaker in our Autumn Health Pick series. It was wonderful. And I hope everybody has a fabulous day. Oh, there is one more question. Somebody asked, what is the amount of vitamin D that one should take in a day? They have heard in the range of 2,500 to 5,000.
That's going to depend on male, female, or kind of like how old you are. I think 2,000 is generally recommended. However, that might be too high for children. So I'm not completely sure about that. It's going to depend on a lot. That sounds kind of high, but I've also heard that they're kind of shifting those recommendations as well. So
yeah, I definitely just talk to your healthcare provider, because it depends on where your blood levels are, your vitamin D levels are. So I would definitely say talk to your healthcare provider about that. So, and one last question before we go: is too much vitamin D a problem?
It can be, yes. So in some of these studies, in these clinical studies, they've given them like very high doses of vitamin D, but the key caveat there is kind of like Chelsea just said, that a lot of these patients are very low in vitamin D to begin with. So it can be, they've seen some issues with calcification of certain blood vessels in too high of vitamin D supplementation. So it is going to be something you're going to want to research and consult with somebody on before you start doing it too heavily.
Yeah, so before you alter anything too greatly, it's always good to consult with a physician or a nutritionist or, you know, somebody in the field. So we always suggest that. So, all right. Thank you, Noah, for wonderful information. I hope everybody out there stays well. Again, we hope you can join us for our last session, which is going to be next Wednesday. Again, we are recording all of these. And so at the end of the session, we will send out an email with a link to the website where all of the recordings are. And next week is Staying Sharp, Maintaining Brain Health as You Age, which is important for all of us. So we hope to see you next Wednesday. Take care, everybody.